While we all continue to grapple with the sudden and untimely loss of Supervisor Chan just over a year ago, today is an opportunity to celebrate the renaming of this site as the Wilma Chan Highland Hospital campus. I'd first like to acknowledge and thank the Chan family for continuing to share their mother, sister, and grandmother with all of us and the communities Wilma served and lifted up here in Alameda County and throughout the state. We are joined today, and we'll hear later from a couple of family members. Today with us is Wilma's daughter Jennifer and her family, Wilma's son Darren and his family, and Wilma's sister May Chen and her husband visiting from New York. Wilma's colleagues from the Board of Supervisors, who unanimously approved naming the Highland Hospital campus in her honor, are here today along with several other local elected officials. I'd like you to please hold your applause while I recognize the Alameda County Board of Supervisors, Board President Keith Carson, Vice President Nate Miley, Supervisor David Halbert, Supervisor Dave Brown, and Supervisor Richard Valle. Also with us today, Auditor Controller Melissa Wilk, as well as Sheriff Greg Ahern is represented by Under Sheriff Rich Lucia. From the City of Oakland, Council President Nikki Fortunato Bass, and the Mayor of Dublin, Melissa Hernandez. I know there are several county department heads and Alameda Health System board members and executives who are present here as well. Again, I want to thank all of our Alameda County friends and family, community partners, and stakeholders for joining us here today to honor again our friend and colleague, Wilma Chan. Wilma Chan leaves a lasting legacy built on her deep commitment to lifting up the underserved and uninsured, providing hope and opportunity to individuals and communities throughout the county and well beyond. Healthcare was Wilma's passion, as was Highland Hospital. From those early days when Wilma served along with Supervisor Keith Carson on the Board of Trustees of Highland Hospital during some extremely challenging times, to supporting the transition to an independent hospital authority, to helping lead the campaign for Measure A and AA to secure a dedicated revenue source for the hospital, and building this new acute tower and Highland campus, a $700 million capital project in investment of county general funds to provide state-of-the-art health care for all. This is Wilma's legacy, one that inspires others to dream more, to learn more, to do more, and become more. Let's hear more from Wilma's county colleagues, Alameda Health System partners, and family members today as we honor and celebrate her life and legacy. We'll hear first from the Alameda County family. We're going to welcome forward Board President Supervisor Keith Carson, who will be followed by Supervisor Dave Brown and the County General Services Agency Director, Kimberly Gassaway. Supervisor Carson.
Thank you very much, Susan. First, let me again underscore and acknowledge my colleagues who are here from the Board of Supervisors, and let me just go on record publicly that there was not even a thought or consideration. It was absolute that we would think that it was very appropriate to rename Highland Hospital the Wilma Chan Highland Hospital. I have known Wilma for a number of years, supported her when she ran for her first office on the Oakland School Board way back some 30 plus years ago. She was very passionate at that time around young people and children's issues. She was very focused on making sure that young people and children were healthy in all capacities, and all of the supportive services that are needed to make young people as healthy and their families as healthy as possible. But Wilma took that passion to a place that really underscores why it is more than appropriate to name this facility the Wilma Chan Highland Hospital. As the former Assemblywoman from the years of 2001 to 2006 and as chair of the Committee on Health, she introduced bills, she authored bills, she co-authored bills and legislation that is still impactful in the healthcare industry today. Healthcare was indeed her passion, but also what she gave to us was a stronger healthcare system here in the state of California. She introduced and co-authored legislation that dealt with healthy families, advanced alcohol and substance abuse for young adolescents. She introduced and authored and co-authored legislation that's still impactful today in the Medi-Cal area, in the public health area, in the children's issue area, and in the aging and long-term area. All of those things would underscore the fact that we should, in fact, feel very proud to rename this institution the Wilma Chan Highland Hospital. And I'm so proud to be able to stand here as a former colleague and as a friend and be able to say that. Thank you.
Wilma loved Highland Hospital. She was a committed supporter for the healthcare safety net, for the safety net overall for children and families and for immigrants and seniors and all vulnerable populations. She was a fierce warrior for social justice. She was a voice for those who did not have a seat at the table. She was a trailblazer. First Asian American on the Board of Supervisors, first Asian American and first woman to be majority leader of the state assembly. She sought out those roles because she wanted to make a difference on the issues that were near and dear to her heart. As Supervisor Carson noted, so much of the work she did in Sacramento was around healthcare. At the county level, she could have an impact on what was originally or initially known when she came to the board as the Alameda County Medical Center and eventually the Alameda Health System. And when she was at the state, she could pass legislation and be part of setting policy and budgets that would impact communities that she represented. She was, to so many of us, a mentor and a friend. I first started working for her when she was on the school board, and really my professional career was built around one person and what she represented. And because of the role that she played, because of the example that she set, because of the values that she held, so many of us in the Chan clan, those that are current and former staffers of hers, were so loyal to the work that she did and the leader that she was. I'm so proud to be able to stand here today as we officially rename Highland Hospital the Wilma Chan Highland Hospital. I was proud that I was able to be part of that vote along with our colleagues on the board to make that happen. This last year has been about trying to really honor her legacy, to find ways to bring forth and continue the work that she has done. And the work that she has done is long lasting. I appreciate you being here today. I'm so glad to see her family here. It means so much to all of us that are part of that legacy. And everyone here in this audience right here is part of that legacy that Wilma has set. And I just want to say thank you to you and the work you do every day, not just here at this hospital, but in the community. So thank you very much.
Grab my notes. First of all, to the family at Wilma Chan, it's an honor and I'm humbled to be here today to recognize Jennifer and Darren's mother and your family. So on March 29, 2022, the Alameda County Board of Supervisors approved a resolution for the naming of the Highland Hospital campus to the Wilma Chan Highland campus in honor of Supervisor Wilma Chan. The Highland campus includes the Alameda Health System Level 1 Trauma Center, state-of-the-art healthcare center, and the Alameda County Board of Supervisors approved and allocated nearly $700 million towards that project. The building replacements and renovations were all over the campus. Supervisor Chan, as was mentioned, was the chair of the county's healthcare committee and a key advocate for that project, which included the new Highland Care Pavilion behind you here, and also the acute care tower right here to my right, and it aimed at providing nationally renowned inpatient care that includes top-flight maternal child services and other advanced treatment facilities. Completed in 2013, the Highland Care Pavilion was the project's first phase and features an 80,000 square foot, I have to read the statistics, outpatient and specialty care center. The 3-story facility was built over a 172 space parking structure and includes connectors to the new hospital. The Highland Care Pavilion offers an improved experience and increased accessibility to patients and visitors. Artwork from our art commission is displayed throughout this and was created by 13 Alameda County local artists to help create a positive, supportive, and healing environment for patients. Phase 2 consisted of the acute care tower over here on my right or your left. It's a 9-story, 169-bed acute care facility. It is located above a below-ground central utility plant and features intensive care, medical surgical beds, labor delivery, neonate intensive care, and miscellaneous diagnostic treatment and support function. The final third phase of the project included a demolition of a tower which used to exist here and was imploded on site with patients in the rest of the building. Pretty incredible. So the demolition of that inpatient tower and construction of the interior courtyard, as well as a new hospital entrance, was completed. These new facilities unify the campus both functionally and architecturally. For sustainability, the Highland Hospital project achieved a Leadership, Energy, and Environmental Design Gold certification, one of the higher certifications that you can get. The project's sustainable components included innovative thermal storage that lowers energy costs by operating chillers at night to cool and store the water. Exterior green screens provide transitions and wayfinding for patients and visitors while cooling the building and shading the interiors. The project team paid particular attention to life cycle costs while selecting the building materials. On March 29th, as stated, the board resolution also directed the General Services Agency Director to announce the name change. So right now, I'm going to announce the Wilma Chan Highland Hospital campus. I was also directed, in partnership with the Alameda Health System, to install the name upon the property. And to this effort, GSA procured design services of Shannon Lee. You can see the mock-up here, strategic placemaking from San Leandro. She is a certified small local and emerging business, and also a certified woman business owner. GSA and AHS have reviewed the design and the placement, which will be on the front of the main entrance. Today we've placed a banner to represent where that will be, and there'll also be lettering along the driveway entrance wall as you come in. On November 1st, the board approved a contract amendment for construction management services with Vanner Construction, a Hispanic woman-owned firm, to oversee the construction and installation of the new sign. Fabrication is underway and construction is projected to occur in February, but given the near end of the supervisor's term, it is appropriate today that we celebrate and make this announcement at this time. GSA would like to thank AHS for the collaboration and partnership, not only in the renaming, but as we work together and build our relationship to ensure great infrastructure for the community that we serve. So on behalf of the entire GSA family, I'd like to give best wishes to the Chan family. Thank you.
Thank you. As noted, none of this would have been possible without a strong partnership with the Alameda Health System. And we're now going to hear from Dr. Taft Bouquet, the President of the Board of Trustees, as well as CEO James Jackson.
Good afternoon and welcome to our county partners and advocates, to our AHS employees who are all here, and most importantly to the Chan family. My name's Taft Bouquet. I'm the chair of the Alameda Health System Board of Trustees, as well as the chief of gastroenterology and hepatology here in the system. On behalf of my fellow trustees who are here, it is my privilege and honor to say a very few brief words at this dedication event for Wilma Chan. Our health system and our patients have been the beneficiary of multitudes of dedicated and faithful public servants during its history. Many of them are here today. Many of them are working in those halls right now. Still, I can think of no single individual who has had a more profound impact on this health system than Wilma Chan. Her dedication to our system, our patients, our mission is what frames why we are here today. It is very fitting that her legacy be memorialized as we are doing today. On a personal level, I found Supervisor Chan to be a powerful advocate and coach, teacher, mentor. She was tough, she was smart, she had vision, and I think everyone knows she didn't mince words. She was also pretty good at providing counsel, even if it was the care of my dog. She loved to talk to me about my new COVID dog, Kenji, and she would talk about Maggie. So she gave good counsel in that regard too. I deeply appreciated the relationship. I think of Wilma often when I walk past our chapel up there, when I'm walking my dog Kenji on Shoreline Drive, and when I think about how far this organization has come. These are good moments. It reminds me of how fitting it is that we are here and that we gather for here today to remember her in perpetuity on this Wilma Chan Highland Hospital campus. Thank you. Watch the mic, sir.
Good afternoon. My name is James Jackson. I am the CEO of the Alameda Health System, and it gives me great pleasure, although this is a bittersweet day, it gives me great pleasure to have the opportunity to speak to you as we rededicate the Wilma Chan Highland Hospital. In addition to the dignitaries that Susan Mornishi noted, I'd like to recognize my Board of Trustees, and so I have Tracy Jensen, Kinkini Banerjee, in addition to our chair, Taft Bouquet, and I believe that is all of the trustees who are here, but I want to just acknowledge all of you. And Supervisor Brown said it, Jeanette told me it was okay, so I'd like to ask the Chan clan to stand up and be recognized. All of you who are members of the Chan clan, please. I will just say to you, they roll deep. There are always a number of them at the different events, and so welcome to the Chan clan. Alameda Health System has had many champions throughout our rich history, but I dare say none as committed or as passionate as the late Supervisor Wilma Chan. Caring, healing, teaching, and serving all is the mission statement of the Alameda Health System, and I feel that Supervisor Chan was the embodiment of that ethos. I came to know Supervisor Chan when I was the Chief Administrative Officer for Alameda and San Leandro hospitals, both which were in her district. Her passion for our community was abundantly clear. During the process of San Leandro Hospital being acquired by the Alameda Health System, I saw firsthand her drive, her tenacity, and her creativity. Supervisor Chan has been synonymous with healthcare in our county for more than 25 years and was integral to the oversight and success of the Alameda Health System. I have photographs of Supervisor Chan with my father here at what was then known as the Alameda County Medical Center for the dedication of the Correct Pavilion, the building where our emergency department is, many years ago. Supervisor Chan recognized early on the value and the potential of the Recipe for Health program, also known as Food is Medicine, led by Dr. Stephen Chen, that originated here in the Alameda Health System. And working with our partners at the Alameda Healthcare Services Agency, shout out Colleen Chavla, the supervisor led the effort to spread Recipe for Health across Alameda County. That growth has continued, and now Dr. Chen and our local Recipe for Health team is helping to lead this work nationwide as one of the first implementers to make this a Medi-Cal covered service for our patients. Supervisor Chan profoundly understood how important San Leandro Hospital was to our community. She was committed to ensuring the hospital's sustainability as an invaluable resource to the community. She was a formidable leader, especially when it came to ensuring access to health care for our community. There are moments that I recall when it didn't seem that the deal for the acquisition of San Leandro Hospital by AHS was going to be finalized. The various entities involved were entrenched, and the transaction became increasingly unlikely. It became clear to me that Supervisor Chan was not going to allow the parties to walk away. And to paraphrase Don Corleone, she made offers that could not be refused. And the deal got done. It was apparent to me that for Supervisor Chan, failure was not an option. We remained in touch over the ensuing years, and she was one of the primary reasons I was motivated to return to the Alameda Health System as CEO. Supervisor Chan would reach out to me in my role as CAO for San Leandro and Alameda hospitals, and later as the CEO for the system, with a couple of simple questions. How are you doing? And how can I assist? Whether or not I had something specific to ask of her, it was comforting and empowering to know that she cared and was there to support the work of the Alameda Health System. It is, I think, a special tribute to the late Supervisor Chan that despite all of her great achievements and successes, we find ourselves today thinking first, not of her deeds, but of her unwavering commitment to our community. It was her character that captured the trust, faith, and affection of those she interacted with. I personally consider her a role model, a visionary, and a friend, and I strive every day to be worthy of the confidence and trust that she showed in me. I could not be prouder to have Wilma Chan's name at the front of this anchor in our community, honoring her legacy of support. Health is a human right, not a privilege, and of serving all. Thank you very much.
Thank you. We're now honored to hear from Wilma's family. First from her sister, Mei Ying Chen, and then her son, Darren Chan. Thank you.
Wow. Good morning, everyone. My name is Mei Chen, and I came here from New York City because I really feel strongly that this is such an important day. And on behalf of our extended family, I'm honored to be president for this renaming of Wilma Chan Highland Hospital campus. Wilma is surely looking down on us from heaven. We hear her voice in our ear as we continue to carry on the causes and projects she started. Her spirit lives on in us. I want to thank Dave Brown and the staff that he and everyone affectionately call the Chan Clan. Wilma was so proud and grateful to all of you in her staff for turning her ideas and visions into reality. Thank you also to Wilma's longtime friends who are here today, and to her kids, Jennifer and Darren. We've all come through a tough year, and yet it has been heartwarming to witness the outpouring of tributes and love for Wilma, and to know that she will not be forgotten. Today marks one big step to remember the important hard work Wilma devoted to the important, essential issue of healthcare. As her older sister, I've known Wilma all her life. And I can confirm she was pretty opinionated and stubborn, although we say tenacious, from an early age, always calling out anything wrong or unfair. Even though I'm the older sister, I have to admit she was always the boss. Wilma went into electoral politics in the 1980s and 1990s. And for her, as prior speakers have mentioned, it wasn't about ego, fame, and fortune. She ran to represent and make a difference for everyday people. She truly was a pioneer 30 years ago when she started her political career, and she stayed true to her goals and beliefs all her life. Healthcare was a key career passion for Wilma, and not only in the recent years of the COVID pandemic, Wilma always fought to make sure health services were accessible and affordable to everyone. She was an early advocate and supporter of child and family health programs and culturally sensitive clinical services. During the lengthy quarantine periods of the COVID pandemic, Wilma and I spoke on the phone quite a lot. She was studying all the latest news, data, and advisories, and always looking for ways to take care of everyone, especially the most vulnerable of her constituents. Wilma, in 2009 to 2013, became the main caretaker for our dad when he moved from the East Coast out to California. She managed all of his healthcare issues, and her personal love and care flowed from her professional expertise in health policy. I could really see that combination of her personal love and her professional expertise. So Wilma and her team, all of you, connected all the dots from healthcare to food, nutrition programs, youth, fitness work, and she always bragged about how smart her staff was, how smart all of you were. And so you need to know how much Wilma loved, appreciated, and respected all of you for your energy and hard work. As 2022 draws to a close and many changes are on the horizon, let's remember the Wilma Chan experience and carry that sense of solidarity, family, and commitment forward. Thank you.
Good afternoon, everyone. I'm Darren Chan, Wilma's son. You know, when planning for this event began, my initial reaction was to decline the opportunity to participate. Over the last 13 months, the last memory I have of my mom is here at Highland Hospital, having to say goodbye to her. Selfishly, I didn't want to face the feeling of sadness again. But as I've had time to reflect on this great honor bestowed upon my mom, I realized that this tribute, more than any of the other renaming tributes, is so important and meaningful, and one that my mom would be so proud of. So it is with a heavy heart that I'm here today representing and speaking on behalf of my family. Of the thousands of times that I've relived the event being here at the hospital with my mom, one thing that has brought me constant solace was the care, love, and support of the hospital staff that showed my mom and my family. Sorry. I recall the nurses holding us as we cried, the doctors giving my mom the highest level of care, and the staff, including James, being there to console us in our greatest time of need. Their love and compassion really helped me through this tragic loss. And as a result of this experience, I now truly understand why my mom was so passionate and dedicated to Alameda Health System and Highland Hospital. This hospital is a place that cares for everybody. Sorry. When my mom was brought to this hospital, she had no identification on her, so there was no way of knowing who she was or whether she was a patient of the hospital. It didn't matter. The hospital took her in and did everything they possibly could to try and save her life. This is what they do for any patient that comes through their doors, and this is why my mom cared so deeply about this health system. This hospital was one of her greatest legacies simply because what this hospital does and stands for is perfectly aligned with what my mom's core values were: supporting and caring for those who need it the most without prejudice. My mom spent so much of her career focused on healthcare, and especially this hospital, whether it was saving it from shutting down, modernizing and expanding it, or putting the right leadership in place, because she wholeheartedly believed that this hospital's success meant the better life for thousands of people. My mom knew that the value of her work only went so far as the people that benefited from it. I truly believe that that of all of her accomplishments and work to support and uplift the community, her work for this community, she had none greater impact than the work for the community than the work at this hospital. And she knows that her work would not have been a success without the support and the relationships she built with numerous AHS, Alameda County, and healthcare community advocates, and their tireless and relentless work to make Alameda County a better place to live. So I want to thank AHS and Alameda County for all of your work on this renaming effort. And I especially want to give a shout out and my love and appreciation to Supervisor Brown and the Chan clan for all that you have done in the honor of my mom. Your work and dedication to my mom made her vision into reality, and my family is forever grateful for everything that you have done, not just for this renaming effort, but for everything you've done for this past year. We greatly appreciate it, all in the honor of my mom. I personally want to say how much I love and support all of you for the support you've shown us. You are our family. So while it's very difficult to be here today, as an Oakland resident with a 2-year-old son, I will drive by this beautiful campus and look atop the building and see my mom's name and share with him the amazing legacy that his grandma left behind. Thank you.
Thank you all for sharing your personal and unique perspectives on the life and legacy of Wilma Chan. Nobody could have said it better than all of you whose life she touched and were so close to her. As Maya Angelou, poet and activist, said, if you are going to live, leave a legacy. Make a mark on the world that cannot be erased. Wilma did just that. She leaves an indelible mark on the world, now including the Wilma Chan Highland Hospital campus, that cannot be erased and is a lasting legacy for generations to follow. Thank you again to family, friends, colleagues, partners for sharing this special day as we officially name the Wilma Chan Highland Hospital campus. Please stay, mingle, join us for refreshments hosted by our partners at AHS. Please travel safely and enjoy the holidays. Thank you so much for being with us today.